to this PSNA webinar, Transforming Care Through Telehealth. The objectives of this webinar include defining telehealth and telemedicine, identifying types of telehealth technology, describing the role of the professional nurse with regard to telehealth services, and detailing opportunities for services to improve patient outcomes. Let's go back to the future. Take a look at the cover of Radio News magazine from 1924. This picture depicts a telehealth encounter 2 years before the invention of the television. You may note that the patient and physician are able to visualize one another, and the physician has the ability to assess the patient utilizing a stethoscope. For many years, the telephone has been used to assist healthcare providers in caring for their patients. Although the phone has changed in size and shape, we continue to use this tool for the exchange of patient information with the goal of improving patient outcomes. There are no universally accepted definitions of telehealth and telemedicine at the present time, and telehealth and telemedicine are often used synonymously. According to the American Telemedicine Association, telemedicine involves the electronic exchange of medical information from one site to another to improve a patient's health status. On the other hand, telehealth is a more inclusive concept than telemedicine. Telehealth addresses the use of information technologies not only for delivering medical care remotely, but also for delivering preventative health, education, and other interventions virtually. The Health Resources Services Administration, or HRSA, defines telehealth as the use of electronic information and telecommunications technologies to support long-distance clinical health care, patient and professional health-related education, public health, and health administration. Telehealth telemedicine technologies include video conferencing, store and forward imaging, streaming media, terrestrial and wireless communications, along with other forms of telecommunications technology. There are 2 major forms of telehealth technology. Store and forward technology is used as a way of sending patient information to a provider that will be used for review at a later time. Interactive audio-video is utilized for a virtual encounter between a patient and a provider in real time. One example of store and forward technology is transmitting patient information using a digital camera, personal computer with internet connection, and web-based HIPAA-secure software to a specialist at a tertiary care center for their review and assessment. The specialty care provider has the ability to view the images and information, allowing them to provide recommendations and expediting the care of the patient. The cloud is a secure virtual warehouse where multiple facilities, both internal and external, can upload and share images and reports. It speeds up the delivery of critical information to a care center before a patient's arrival. It also eliminates the need to wait for studies to be burned to a CD, which may be lost during transfer of the patient or may not be able to be opened at all by the receiving facility. Studies may be downloaded from the cloud into the patient's medical record at the tertiary care center. In addition to radiology images, it also supports PDF, JPEG, and other patient information documents. Interactive audio-video technology can be used for a real-time assessment of a patient by a specialty provider. Various peripheral devices may be connected to the video conferencing unit to assist in the exam. These devices may include handheld exam cameras, video otoscopes, ophthalmoscopes, and pharyngoscopes, and electronic stethoscopes, which transmit heart and breath sounds. This video illustrates a real-time encounter. With the use of an exam camera, up-close visualization of a wound can be shared to assist with the assessment of the patient. As a nation, we are in the midst of many changes in healthcare. The purpose of the Affordable Care Act is to move healthcare from a fee-for-service model to an outcome-driven care model. The goal is keeping our country healthy and reducing the cost of health care. Penalties may be incurred by hospitals for certain diagnoses that may result in readmission within a 30-day discharge period. These penalties are applied when a hospital's 30-day readmit rates are higher than the national average. According to the Association of American Medical Colleges, due to the increasing number of Americans over the age of 65, by 2020 our nation will face a serious shortage of both primary care and specialist physicians to care for our growing population. As healthcare workers, we need to find tools that can assist us in maintaining or improving the level of care we are providing to our patients and be cost effective as well. Telehealth and telemedicine offer these tools. As a result of these changes, accountable care organizations are being developed. The purpose of the Accountable Care Organization is to promote evidence-based medicine and patient engagement, report on quality and cost measures, and coordinate the care of the lives that they oversee. Telehealth can facilitate this through remote patient monitoring and other such technologies. In an attempt to address the changes needed in healthcare, the Institute for Healthcare Improvement developed a framework to optimize our health system performance, referred to as the Triple Aim. There are 3 areas of focus: improving the patient care experience, the quality of the care, and satisfaction, improving the health of populations, and reducing the per capita cost of healthcare. The United States spends more on health care in comparison to all other countries throughout the world. Our spending accounts for 17% of the gross domestic product in the U.S. and is expected to grow to 20% by 2020, according to CMS. We must as a nation cut costs, but are also tasked with improving the health and wellness of our citizens. The IHI recommends that we change our focus of how we have been providing patient care by identifying target populations, known as population health management, and by focusing on individuals and families. Defining system aims and measures by redesigning primary care services and structures and controlling the cost of health care. In turn, we will have healthier communities that require less complex care. From a nursing perspective, the National Council of State Boards of Nursing released a position paper on telehealth nursing practice. This paper addresses the practice of the nurse utilizing telehealth, regulation over nursing practice through broadband and electronic channels. It highlights teaching coaching skills and administer and monitor functions which are embedded in the nursing practice. According to the American Nurses Association's 2010 Scope and Standards of Nursing Practice, Standard 5 implementation the nursing competency in utilizing technology is addressed. It includes the measure of patient data, recording of patient data, and retrieving of patient data, implementing the nursing process, and enhancing nursing practice. Within the same document, the ANA addresses their support of the use of technology to communicate health promotion and disease prevention information. Through our experiences as nurses developing telehealth programs and services, we have identified nursing skills with relation to telehealth. Comfort with technology is a must. In most cases, it is the nurse who is physically located with the patient and needs to be able to explain what is occurring throughout the virtual encounter, provide education to the patient, have a comfort level with presenting the patient to the provider, and other skills that are important for nurses to possess are patient advocacy, effective communication, triaging, and critical thinking and knowledge of their scope of practice. With nurses acting as the hands of the provider, they not only need to feel comfortable performing tasks under the direction of the provider, but also know their professional license limitations. Nurses must be key members of the interprofessional telehealth team to ensure the patient remains at the center of care. There are many types of telehealth services. The Tele-ICU is a centralized remote monitoring unit where a team of clinicians work together, utilizing the latest in electronic medical record information, remote monitoring technologies, and two-way audio-video. The Tele-ICU uses both store and forward and real-time video conferencing technologies to virtually monitor and care for patients. Tele-intensive care units are typically staffed with a critical care intensivist physician and experienced critical care nurses who have access to the same medical information as the bedside clinicians, such as the electronic medical record, computer-assisted physician order entry, laboratory results, radiology images and reports, and video conferencing. There are various types of specialty services that may be provided utilizing telehealth technologies. Store and forward technology is typically utilized for services such as a telewound or teledermatology program. These services provide specialty skin and wound assessment and diagnoses. One of the first types of services to use real-time video conferencing was behavioral health. An example of a behavioral health service is telepsychiatry, which can be used for consultations with a behavioral health provider in both emergent and non-emergent settings. Another type of telehealth service is teleinfectious disease consultations, which utilize store and forward and real-time video conferencing technologies to assist in the diagnosis and treatment of patients in critical access hospitals who may not have access to an infectious disease physician. Teleneurology services extend access to neurospecialty care. Examples of acute and chronic care provided through telehealth could include telestroke and teleparkinson's. Telestroke service provides acute intervention by a board-certified vascular neurologist for stroke patients in critical access hospitals with the goal of improving patient outcomes. Teleparkinson's is a chronic neurologic service for patients with movement disorders. This type of a service allows patients to remain in their skilled nurse facility or in their own home. Due to the movement limitations related to their condition, This service facilitates specialty neuro care without the inconvenience and stress of travel. By looking at this photo, it may appear to be a burn. It has some irregular edges, variation in colors, and indicates possibly a partial thickness to full thickness burn injury. However, with telehealth, it's very important to remember that we must see the big picture. As it may not always be what it appears. As telehealth expands, there are many resource centers developed throughout the United States. Here are some that you can access, and they will be able to assist you with the development of a telehealth service at your own facility. We hope you have enjoyed this webinar. Thank you for your participation.